Welcome back to another episode of the Daily Wisdom Words podcast, where every week we talk to people who have stories, advice, and life hacks, all of which take you one step closer to that feeling of hope. I'm your host, Neil Trevedi. This week we will not be joined by my co-host, Rini. She's having some technical difficulties. There was a power outage where she lives, but we wish her the best, and I will be reading the questions that she sent along for this interview. And with that said, we are so privileged to be joined by licensed clinical psychologist, Dr. Jessica Rabon. Hi, Dr. Jessica. How are you?
Good. How are you, Neil? Thank you so much for having me.
Yeah, absolutely. And I should probably tell our viewers, our audience, listeners as well, that strap in because there's a little bit of controversy surrounding today's topic. I know there are definitely, people who support it, people who don't. We will get into all that. But before we do that, can you talk a little bit about your background, what you do, and what exactly does a psychotherapist do?
Absolutely. So like you said, I'm Dr. Jessica Rabon. Pronouns are she, her. I'm a licensed clinical psychologist. So currently I work in a children's hospital where there I have two roles. So a day and a half a week, I work outpatient in our adolescent medicine clinic. And there I primarily treat depression, anxiety, eating disorders, and then provide LGBTQ health care. And then the other 3.5 days a week, I work medical inpatient, which a lot of people think psychologist and inpatient, they think psychiatric inpatient, but I work medical inpatient. So I work with physicians, child life, PT, OT, and provide comprehensive integrated care to children who have medical illnesses, are experiencing physical traumas, such as those that have been in a car accident or have like gunshot wounds, things like that, as well as provide care for individuals with eating disorders. So that's kind of what I do in a nutshell. As for what a psychotherapist does, so psychotherapists provide evidence-based mental health therapy and treat mental health conditions. In addition, they do treat things that are not necessarily diagnosable. So like people can go to therapy for relationship problems, life transitions, stress, things like that. So a psychotherapist could hold various degrees. So you can have, I can only speak to the United States, but licensed clinical social workers, licensed marriage and family therapists, licensed professional counselors, and psychologists like myself. One of the main differences between psychologists and other psychotherapists that are only master's level, psychologists do get extra training in psychological assessments, which master's level clinicians do not. I currently don't do any psychological assessments. I used to. I am a psychotherapist and provide therapy just like a licensed clinical social worker would and things like that. And I always tell people that it really doesn't matter what degree a person has as long as you feel comfortable with them and they specialize in what you're seeking therapy for. And they can provide the therapy that you need. That's what's really most important.
And one area of interest for you is, as we talked about leading up to this recording, is gender affirming care. So let's start with that. What exactly is that, and what makes why is that so important?
Absolutely. So before I jump in, I always like to make the disclaimer that I am a cisgender female, meaning that my sex assigned at birth aligns with my gender identity. So although I provide gender affirming care, I don't have lived experience being transgender, non-binary, or gender diverse. But at its core, gender affirming care is medical and psychosocial health care designed to affirm an individual's gender identity. So it affirms diversity in gender identity, it assists individuals in defining, exploring, and actualizing their gender identity, and it allows that exploration without judgment or assumptions. So on the medical side, care is, routine preventative health care. It could also be things like hormone replacement, surgery, and other medical interventions. Mental health services would include therapy with a therapist that is knowledgeable and affirming in LGBTQ health. It could be psychiatric medication, as well as letter writing. And what letter writing is in the United States, I can't speak for other countries, For individuals to receive the more medicalized treatments, such as hormones and surgery, especially depending on age, they oftentimes, if not all the time, need a letter or two from a mental health provider that says that their mental health is stable enough to go through this medical procedure, whether it be hormones or surgery or another medical intervention, as well as like they meet criteria for gender dysphoria. They understand the risk and benefits, and nothing about their mental health would interfere with their ability to do the aftercare and things like that. So gender affirming care is really individualized to the patient. It really focuses on the needs of the individual. And we'll get into this because we're going to talk about kids, but it also is really about providing developmentally appropriate psychoeducation about gender and sexuality for kids. That includes their guardians as well as their family. It can be social interventions, etc. So it's very comprehensive, very broad, and a lot of things are things that cisgender people are also getting. I know the second part of your question is like, why is it important? And obviously I'm biased because I provide it, but first of all, we know that LGBTQ plus individuals, whether gender diverse or gay, bisexual, lesbian, pansexual, etc., experience health and healthcare disparities compared to non-LGBTQ individuals. So they're more likely to be underinsured, uninsured, more likely to receive poor quality healthcare, face discrimination in healthcare settings. So if somebody identifies as LGBTQ plus, and especially is gender diverse, they may delay necessary care out of fear of discrimination, or someone who is not affirming may not treat them, and not maliciously, but treat them poorly. They may not understand their specific stressors and specific things that LGBTQ plus individuals go through. Secondly, gender affirming care has been associated with a lot of positive outcomes, such as better psychosocial functioning, reductions in depression, reductions in anxiety, reductions in suicidality, increases in overall well-being, which I think is something that we all want from any of our healthcare providers. Like, we want to feel better. And that kind of brings me to my third point as to why I think it's so important. And it's that at the end of the day, regardless of our identities, we all want to be heard and affirmed in our identities. We all want to feel safe when we walk into a doctor's office, when we walk into a therapist's office. And, you know, you, Neil, me, or anybody listening, like when we go to a doctor or therapist, we want that person to see us for who we are. We want that person to address us by name, use our correct pronouns, acknowledge individual factors that may be contributing to why we are seeing there, actually listening to our concerns. It's something that we all want and deserve in healthcare. And unfortunately for LGBTQ plus individuals and transgender and non-binary individuals specifically, they don't get those basic things that we all deserve in healthcare. Healthcare can be unsafe. And like I already said, so that may limit them from receiving quality healthcare. It may cause them to avoid seeking healthcare because they don't want to be discriminated against. And so I think all of those things that I listed are really important, but I think if people can think about it in a way of it's just basic human dignity and something that we all want and deserve, it's a way to kind of provide more understanding.
Absolutely. I think that's a very good point. And when we get, and we'll get into the misconceptions in a minute, but and would I be correct in saying that the reason why it's so crucial to provide that, especially in minors, right, is because from my experience, we've had transgender people and people from the LGBT community on this podcast before. And also, of course, I've had friends and things like that. I've grown up with friends who have struggled with, had those kind of struggles all their life. And one thing that I've observed is it almost always starts as a kid, right? It's never, you're not going to find a transgender person that all of a sudden a senior citizen woke up and say, now that I think about it, I don't feel comfortable in the body I was born in. That doesn't happen, right? The feelings
Correct.
always start from when they're young, and they know it. Maybe they may not be able to articulate it always as well as adults could, but right. So would I be correct in saying that's why it is crucial to start at a minor age if you're going to provide that care to the people who are conflicted about their sexuality or their gender or whatever else they're feeling conflicted about?
Absolutely. And you just highlighted so many good points, Neil. So what we know about gender identity and gender development is, and this is from, I always clarify, this is from like developmental research that really has nothing to do with trans and non-binary kids, but just in general, how children develop. Around 3 years old, children have a sense of gender and gender identity.
Right.
Now, that does not mean a number of 3-year-olds are telling mom and dad or whoever their guardians is, hey, I think I was born in the wrong body. You keep calling me a girl. I'm a boy. No, but children, young children have a sense of of gender and gender roles, gender expression, and things like that. And what we find is, some kids are able to recognize like something's not right. Maybe if they live in a household that's more accepting and affirming, they've heard the word transgender before, or things like that. And so maybe they are exploring their identity. So we definitely have those young kids. And then at puberty is when we kind of see a lot of changes. So for kids that maybe are gender diverse prepubescently, we actually see a lot of kids once they go through puberty are like, actually, no, now that I've gone through puberty, my gender identity aligns with my sex at birth. Or we see the complete opposite where they're like, oh gosh, now that my secondary sex characteristics have developed, I am very, very uncomfortable in my body. Once again, that doesn't mean people are necessarily coming out at that age, but I agree with you. Like, I don't know a transgender adult that, at least retrospectively looking back, was like, I am able to pinpoint periods in my life that like I felt different, but did not have the language. So yes, if to your question, if kids are expressing being gender diverse, I think it is important to get them in with a therapist and a medical provider that can support that. And we'll talk about this with the misconceptions, because it can help guide the family, which is really important, and the child, and allow them to feel more safe and accepted, at least. And if they hit puberty and they're like, nope, actually, that was more just me exploring my identity. Now I'm, recognize I am 100% a cisgender female. Okay, cool. That's great. Yeah. And then they can live like, or they've already been established with the care that can prepare them for puberty and help them through that process where things might get more difficult.
Right. Yeah. So let's get into that. Speaking of the misconceptions and all that, why? I mean, okay, I get on some level why there's the backlash. You always have that people who think we're breaking up traditions, their traditional family. That's always, I get that. But as far as misconceptions, what are some of the biggest misconceptions that create so much criticism or backlash against it? Apart from the usual, that's not usual or that's not normal and so on and so forth. Yeah.
The biggest one, which probably is the most frustrating for me as somebody that provides gender affirming care to minors, is that children or like parents or adults are allowing children to, quote, cut off their genitals. Like, I have seen this so many times. And that's what people think. They think like an 8-year-old is walking into a doctor's office and then somehow getting surgery the next day. So to kind of clear up this misconception. First of all, just because a youth is receiving gender affirming care doesn't mean all will undergo or even desire any medical intervention at any point in their life, like even into adulthood. And that kind of goes to what I was saying. You might receive gender affirming care and realize, actually, no, that was just kind of a phase of my life I was exploring. Or they could still go on to realize, nope, this is who I am, but I don't desire any medical intervention, and that's okay. Right. Second, and probably most importantly, no child is getting gender affirming surgery. So any good clinician, so healthcare provider, mental health care provider that provides gender affirming care would follow the World Professional Association for Transgender Health, so WPATH, standards of care. And so standards of care version 8 came out in 2022. and they have guidelines on how to provide gender affirming care. And this includes, but is not limited to, providing it for children, adolescents, adults, guidelines for surgery, guidelines for other medical interventions such as hormones and puberty blockers, mental health care, reproductive health. So in the guidelines, they have a whole section for children, and how a child is defined is somebody that has not gone through puberty yet. So those who have not gone through puberty are not receiving any medical intervention, period. They're not on puberty blockers, they're not on hormones, and they're definitely not getting surgery. So for gender diverse children, really WPATH recommends psychotherapy for the child and their family, psychoeducation in a developmentally appropriate manner on gender diversity, what social transition may look like, future medical interventions if they decide to go down that route, healthcare, education in general. WPATH recommends that providers who provide gender affirming care for youth also get trained and are knowledgeable about neurodiversity, because there is some evidence to suggest children who are neurodiverse are also more likely to be gender diverse. So individuals with autism, for example, have higher rates of gender diversity within that population, which is interesting. There's not a lot of literature on it right now, discussing risk and benefits of social transition. So I think this is a subcategory of misconceptions. People think like if you provide gender affirming care, you're just like, here, go and do it. It's like, no, it's education on this would be the benefits of allowing your child to social transition. So that would be like allowing them to have a hairstyle that affirms their gender identity, dressing a certain way, maybe trying out a different name and pronouns, everything that is 100% reversal. And then allowing the family to make the best decision for their child. So really, as you can see, none of that is surgery. Like there's literally no child who is getting surgery. Yes, there are some older adolescents that may get surgery, because I always I want to be 100% honest. I'm not saying no minor is never getting surgery, but it is extremely rare. And once again, it's usually top surgery. So for trans males, so sex assigned at birth is female, gender identity is male, top surgery is the removal of breasts. And most frequently, if a minor is getting surgery, it would be top surgery and not genital surgery. Prior to Standards of Care 8, it was explicitly stated that genital surgery could not happen before 18. The guidelines have removed that for vaginoplasty, so making a vagina, but not phalloplasty, making a penis. So that is still 18 plus. But I looked up, because I like to prepare for podcasts, and I looked up, Reuters did a big study, and from 2019 to 2021, it was documented worldwide 56 minors, 56 total, received gender affirming genital surgery over
that's interesting.
2 years. So it's not these and they were all older adolescents. So I'm not going to say it never happens, but children, as in no 8-year-old is going out and getting surgery.
It's definitely not like a common thing. And more importantly, it is not people in what you do. You're not the one saying, I think you should have that surgery for sure, right? That is not you.
No, absolutely not. And we'll probably talk about this at some point too, but also the process to getting to surgery is a very long process. And there are explicit guidelines in the Standards of Care of things you need to follow. And, obviously I'm not a surgeon, I'm a psychologist, but a big part of surgery or hormones from my perspective is making sure their mental health is stable enough. So if they're struggling with severe depression and it's not solely related to their gender dysphoria, we have to work through their severe depression before I or their medical provider would be comfortable to say, let's put you on hormones, which is going to obviously impact your emotionality and things like that. And I know the Standards of Care also require, unless it's counterindicated, because some individuals have medical illnesses that going on estrogen or testosterone would actually really hurt them. You have to be on hormones for 12 months before eligibility for surgery and 12 months consistently. So if we think of that, like definitely no 8-year-old is going in with mom and dad saying, I'm a boy, and getting surgery the next day.
Right.
So that's definitely probably the biggest one. Kind of on that vein, I think another misconception that I hear a lot is that people think gender affirming care is only the medical side. They think it's just puberty blockers, hormones, and surgery. And they're definitely part of gender affirming care, but really they're like the latter steps to gender affirming care. So like I've already said, psychoeducation. So providing education on gender, sexuality, gender diversity, things like that. Social transition is always a first step, regardless of age. Even if you are 45 and you finally recognize, like, you know what, this is who I am, you are going to socially transition before you do any medical transition. Dress the way that affirms your gender, maybe cut your hair, wear makeup, things like that. Other things that are gender affirming care, birth control, which people don't think about. But if you think about, if somebody sex assigned at birth is female and they have a period, that can be extremely dysphoria inducing. So they can go on birth control to stop their period. And so that one time a month, their dysphoria doesn't increase significantly. Genital tucking and packing. So using a packer, which is like a fake penis, or tucking. So tucking the penis to make it look more like a vulva, binding the breast to the flatter chest, padding to give yourself a more feminine figure. Those are all gender affirming interventions that are reversible and does not involve medical care. You know, laser hair removal is one. If you are a trans woman, you may get laser hair removal on your face or underarms or arms to affirm your gender identity. Voice modification, and this can be done through speech therapy. There are surgeries for it, but, you know, going to a speech therapist who is trained in voice modification for transgender individuals to increase the pitch or lower the pitch of their voice. Fertility preservation is also gender affirming care. So, you know, many transgender people do want to have biological children in the future. So it might be, you know, keeping their eggs or sperm. And then obviously mental health care is a huge component, which people don't recognize.
I would think to start with, wouldn't it be the probably the most crucial, at least starting with, because if you're helping these people come to terms, whether it's minors or adults, if it starts with, okay, let me help you come to terms with what you're feeling, I would think that mental health would probably be the right at the top, at least at the beginning, right?
Absolutely. And that was actually going to be like the third misconception. I see so many times, especially online, people are like, people need to get mental health help, not change their bodies. And I'm like, they are. And to your point, like it is often one of the first steps. Now, unfortunately, and I say this all the time, mental health care is not accessible in our country. And then finding a therapist that is versed in LGBTQ health, is gender affirming, maybe even harder to find. However, mental health care is part of treatment, especially for minors, but definitely for adults as well. You know, I mentioned letter writing and needing a mental health professional to write a letter saying that they feel like you are clear for surgery, hormones, things like that. And I should clarify, the hormones is for minors. Adults usually don't need a letter from a mental health professional, but adults need letters for surgery regardless. But yeah, it's explicitly in the WPATH guidelines that mental health care, regardless of age, is a necessary part of treatment because, you know, gender identity aside, gender dysphoria aside, unfortunately, trans, non-binary, and gender diverse individuals experience higher rates of mental health problems such as depression and anxiety. I always clarify this as well, which research has shown is usually due to outside factors such as stigma, discrimination, isolation, things like that. And those are all things people have to work through. Also, therapy is a safe place to explore these factors. and to explore their gender identity. I can't tell you how many times I've had individuals in my office who, will try out different names and pronouns in session, but they're not ready to do that at school yet, or even at home. Or we talk about like different ways that they might, maybe they want to try makeup or a different clothing style. But it's a safe space to explore that. It doesn't always mean they go through with it. It doesn't always mean that, they walk out the door and they're like, hey, mom, we're going to go shopping. But like having that person that can explore those things with you, explore why you're feeling this way, address any mental health concerns is extremely important and a necessary part of gender affirming care.
Absolutely. And how does that, when you're treating minors, how do the parents, like, what is their role? Do you is it group therapy? Is it, okay, maybe see the child first, then the parents, then together? Like, how does that all process work as far as the parents or the guardian's involvement in the whole process?
It depends, which is my answer for every mental health question ever. But it depends on the age of the patient and depends on how much they want to be involved. I always recommend, and this is not just for my LGBTQ plus individuals, but for any of my parents or guardians of my patients, I recommend them to get their own therapy if they can, because, having a child in therapy is going to impact you as well, regardless of the situation. But a lot of times I provide primarily individual therapy, but then we would do family sessions as well. So that could be, if I'm doing a 50-minute therapy session, we spend the first 30 minutes, me and the patient, and maybe have the guardian come in for the last 20. It could be, once a month or once every other month, we do a family therapy session. It really depends on the age of the minor, the acceptance level of the parents, because I've had a wide range. So, I have some that are like super involved, super affirming, have done all their research, have already come to me and have been involved in like parent support groups, things like that. So they might not need as much psychoeducation, things like that, versus parents that are like, I want to support my child, but this is very difficult for me. And I don't know even where to start, or I live in South Carolina, so it's very religious here. So we run into a lot of like religious barriers and things like that. I also do parent sessions. So I've definitely had times where I would just meet with the parent or guardian alone and provide, it's not me providing therapy to them for their mental health concerns, but providing psychoeducation and therapeutic support on how to best support their child or provide psychoeducation. So it can look different, but like from the medical side, it depends on the state you're in, but I can speak to my state of South Carolina. In South Carolina, at 16, individuals can consent to their own mental health treatment and some medical interventions. So like they could consent to their own vaccines or medication. But for most medical interventions, if you are under 18, your guardian has to consent for you and the minor provides assent. So from the medical side, parents and guardians are really involved because they have to be going along the journey step by step, right next to them. So, and parent involvement and guardian involvement make it so much easier, in the sense of like, that the individual is in like a safe and loving and supportive environment, even if the parents don't fully understand. And I always emphasize that to my teens, like, you're going through this, but your guardians are going through it too. And they may not understand all the time. And like, yes, it can be frustrating, but also you have to like give them grace. Like as long as they're trying to understand you and support you and recognize that, they're going through their own stuff too. So.
Yeah. Well, and that's, I think that's really good when you have that, even if they don't understand, if you have people in that position who are at least willing to say, okay, teach me or educate me or, fill me in. Why is my child saying this or feeling like this? But as we've talked, as you've talked about before in a social media post, not everybody understands. There was an incident where somebody reported you. So if you want to touch on that a little bit.
So I will say, like, 100%, I'm not even sure if like they actually reported me, because I have not heard anything from the board. But yes, I have definitely had not just one, but multiple people threaten to report me to my licensing board for providing gender affirming care. And it's one, like, it doesn't feel good, but doesn't make me uncomfortable, because I know I'm not doing anything wrong. Like, gender affirming care is backed by American Academy of Pediatrics, American Psychiatric Association. Like, I know I'm not doing anything wrong. But yeah, because people misunderstand and think that, one, I guess they don't really know the difference between a psychologist and like a medical provider. Cause like, they're like, how can you, you know, cut off or perform surgery? And I'm like, I'm not a surgeon. But people just, it's a lack of understanding. They don't understand what happens in the therapy room. Kind of, we touched on this earlier, but it's not just like pushing a person to do things. It's allowing that place to explore, providing psychoeducation so the minor and the family can decide what is best for them. Like, I know I got a question on social media. It might have been on that post I made about the person reporting me. That was like, well, if you always just agree with them, like, you're doing them a disservice. And I was like, my job is not to just agree with someone. It's allow them to explore. It's to help them. It's to better their mental health. And they asked, like, well, have you ever like not written a letter? And I said, yes. Like, there have been a handful of times that I got asked to write a letter for initiating hormones, and I did not feel like the individual's mental health was in a place that initiating hormones would be safe for them. Even though I could recognize that hormones would help their gender dysphoria. And at the same time, if, for example, you have to take, you know, depending on what you're on, like, you might have to take injections of testosterone weekly or biweekly or every other, depending. And if they can't take their mental health medication regularly, or if they're so depressed they're not getting out of bed to shower and feed themselves, it's concerning to me if they would be able to adhere to a regular hormone schedule. And if they aren't, not taking it consistently can be more concerning. I do
with
work
adverse
with some
effects.
Exactly. And it's not me. And I know there's talk in this world of like gatekeeping and things like that. And I fully recognize that can sound very gatekeeping, especially as a cisgender individual. And I have to make a decision that I feel is best for my client. I can think of another example where I do work with some adults, young adults, like those that I was seeing them, they turned 18 and I continue seeing them. And I can think of one that wanted a letter for surgery, and you know, based on working with this individual, it came to my attention that I feel like their cognitive capacity is not what would be sufficient to consent to surgery. And I don't feel like they have a complete understanding of the risks and benefits of surgery. And me and one of the physicians I work with, like, actually sat down and talked with this individual and this individual's family and just said, like, you know, these are the steps. Like, we don't want to tell you can't have surgery, but like, we need you to get an updated psychological evaluation. We need to see these things in place and make sure that you can fully understand the risk and benefits of what you are consenting to, because right now we don't feel that way. And that would be us doing harm if we said, I know you want this surgery, so sure, here's a letter. Like, in good faith, I can't do that. And I don't think people realize that. Like, we aren't just, you know, medical doctors aren't just writing scripts left and right. Psychologists, other mental health therapists aren't just being like, yes, go out and do whatever. There is a process. And unfortunately, I think a lot of people get their information from social media. I always refer people to the WPATH guidelines because they're very long. I will tell you that. And there's like thousands of sources. But if you truly want to know what gender affirming care is, go to the direct source of the guidelines. I think a lot of the misconception too, or one thing I hear on social media a lot is like, well, what about detransitioners? And like people that maybe, you know, lived as a male for a period of time and then decided to quote detransition and live as a female. And like, yes. And what I say is there are detransitioners, and detransitioners' identities are absolutely valid. And it's not a reason to withhold care from other people. Also, detransitioners are about 1% of the transgender, gender diverse population. And the research that we have so far indicates that the vast majority of them detransition for reasons outside of themselves, such as like non-acceptance, increased harassment, things like that. But like, yeah, their identities are valid. And I think I follow a handful of individuals that identify as a detransitioner on social media and have learned a lot from them. And a lot of them also say, like, don't use my identity as a like political, I don't know the word I'm looking for. Like, just because this was my experience does not mean we should withhold things from other people. But I think, you see, and a couple people have gained big followings or made news outlets, and like their stories deserve to be heard, absolutely. But I think people hear those stories and they're like, well, see, this person transitioned as an adolescent and now they're an adult, and they don't want to anymore without like actually hearing their voices.
What are some of the youngest adolescents or minors that you've dealt with that come to you in the starting points? Like, if they're feeling conflicted, I'm just curious about statistic-wise, what are some of the youngest ages that you've dealt with in your profession?
So since I work in our adolescent medicine clinic, the youngest we see is 10. In our clinic. There are younger kids. So one of the physicians I work with is contracted at another outpatient clinic, and he will see younger kids there. The youngest I have personally treated is 11. But I would say the vast majority of my trans, non-binary, gender diverse patients are 15 plus. I have seen, when I was a fellow, this was not why I was seeing the kid, but it came out in my assessment back when I did assessments. And I want to say the child was only about 6, and mom brought up concerns about, not concerns, I don't want to say concerns because mom was very supportive, but like questions about her child's gender expression and things that this child was saying, and just but I wasn't doing therapy. That was an assessment for an unrelated thing.
And this is a question my co-host Rini was keen on asking, so I'll go ahead and include it. What's the process for kids who need therapy that say are in foster care or in a home somewhere? Like, what is the situation? I would imagine it would be even more like complicated for them.
So if children are in foster care, at least in the US, usually they will have a caseworker, and part of the treatment plan may even be therapy. But so it's called DSS in my state, but social services and things like that, they can usually be the first point of reference to help get the child into some type of therapy situation. Foster care is hard because the biological parents still have decision making most of the time. Sometimes it can be temporarily, but since their rights aren't terminated, a lot of the times the parents still need to be on board. We've had this before, and a lot of times if the biological parents aren't available or don't have like decision making depending on the situation, DSS can consent to the treatment. So foster kids definitely deserve treatment and should get treatment, and I hope they are, because there's a lot of trauma to unpack there as well.
Let's talk about your podcast. You have a very excellent podcast, one of the best I've ever heard. Psych Talk, right?
Yeah.
How did that come about? Where can people listen to it? What's it about? And all the good stuff.
Absolutely.
All the good stuff.
So like most people during the pandemic, I found I had extra time on my hands. And so that's when I started really making mental health content on social media. So prior to making mental health content, I did have social media platforms. Like I had a fitness, healthy workout, whatever platform. Like years ago, I ran a blog on Tumblr that had over 20,000 followers. So I've always been on social media, but really it was the end of 2019. I was like, this like fitness health stuff, I hadn't used my blog in years, isn't really me anymore. Like, what can I do? And I was like, why am I not like providing mental health content on social media? Because that's what I do for a living. I love it. I can make it more accessible. So I started, doing that. And with social media, with Instagram, TikTok, I love both of them, but it's very brief information, which is really good in some ways, but also like mental health is so nuanced. And you cannot possibly get all that information in a static Instagram post, in a 60-second reel or TikTok. So at the time I don't talk about this a lot, so privy to some information. I mean, I've posted it online before, but I actually had hired a business coach because I was trying to figure out like, do I want to like monetize my social media? Do I want to go into like the coaching realm and things like that? And I loved her. She was phenomenal. And I decided like coaching is not for me. It just didn't feel right. But one thing that did come out of that was the podcast, because she was like, have you thought about starting a podcast? Because then you can get more of this information out there, but you're not like going on Instagram Live making these super long videos. So I decided to start a podcast. Like you said, it's called Psych Talk, and it's really everything mental health, psychology. And then I also say like self-growth, because not all the topics are like diagnosable mental health conditions. Like, I've done episodes on like boundary setting or like self-esteem, like things that, you might go to therapy about, but are not like diagnosable mental health conditions. So I started it in May of 2020, and I'm on season 4 now because I have taken breaks. I share this story pretty frequently. So I started at May 4th, and May 18th, I found out I was pregnant. So I was like, well, this is interesting. So I did it all through my pregnancy, took a little break when my daughter was first born, and then have done it since. I started having guests on, because when I first started, it was very like solo. And then I was like, I need to bring in people kind of like you do on your podcast that are like experts in things that I am not. And I have learned so much. But... well, thank you. But yeah, so that's kind of how it started. And I always love to take requests from people. I have like numerous whiteboards in my office of just, topic ideas and things like that. And, if I'm not an expert in it, I try to find somebody that is to bring on. But yeah, it's on all major platforms. So Apple Podcasts, Spotify, Google Podcasts, iHeartRadio.
Yeah. So where can people find you on social media?
So my handle is at Jessica Lee PhD. So JESSICA LEIGH PhD. And so that's on Instagram and TikTok. I technically have like Twitter and YouTube. I don't use them as much, but the links to those are in the links of my bio on Instagram and TikTok. Those are the 2 platforms I'm most active on. And then obviously my podcast as well.
Yeah, awesome. And I think this was a blessing in disguise that I forgot the question that I was going to ask you back then, but I think this is a good thing because it's a perfect way to end it. And that is that if minors or anybody of any age, doesn't matter the age, if somebody out there is struggling in the beginning stages of struggling with their identity, be it sexuality or gender or whatever, or if you're a parent or a guardian have just started to notice something like, okay, something doesn't seem right, my child is struggling, my children are struggling, what's the first step on that?
Absolutely. And I love this question. So I would say, especially for children, usually the first step is their primary care provider. They might have some knowledge. And even if they don't, they may be able to refer you. Psychologytoday.com does have its flaws, but it is a resource. And one thing I do like about it, and there's other platforms like this, but you can look in your area, select the presenting problem. You could select like LGBTQ plus affirming therapists, work with children, select your insurance, and that can narrow down some therapists in your area. I also really, even though this is not like therapy, really encourage looking to see if there's any local support groups in your area, whether that is for children, teens, or parents. So like PFLAG is a parent support group. In my area, we have a couple for youth and teens and you can just do like LGBTQ plus support groups in whatever the area is, see what comes up, because that might be a good first step, that you can connect with other people who have lived experience, not only with what you're going through, but also possibly could provide you with insights on what are good physicians, what are good therapists. One thing I didn't mention, but endocrinologists are often involved, because when you're taking hormones, endocrinologists have to monitor labs and things like that. But outside of that, like, I think just validating whatever you're going through, you're not alone. It may seem very isolating. If you're a parent or guardian and you notice that maybe your kid is exploring their sexuality or gender identity, show up for them. You don't have to understand. You don't have to have all the answers, but, supporting them, loving them, asking them, what can I do? Or even if you're noticing things and maybe they haven't said anything, having a conversation of just, I've noticed X, Y, and Z about you. Is this something you want to talk about? If it's not, do you want me to work on maybe finding somebody that you can talk to about it, whether that be a therapist, a doctor. But yeah, and then there's plenty of like online resources. Google is your friend in this. I always hate when people are like, I researched via Google, but like Google is your friend when you're looking for like support groups or, and I can put a list together and send you some, Neil, as well, if you want to do that.
That would be awesome.
But yeah, the first step is like recognizing and then supporting and getting any help that is available, knowing that it might have wait lists and things like that, but supporting your child. And hopefully if you are open, accepting, and loving, even if you don't fully understand, the child is going to be more open with you, and that's going to be key into the success in your relationship.